Hello, thanks for joining us today. My name is Sarah Kern. I'm a clinical assistant professor of child and adolescent psychiatry at the NYU Child Study Center, and I'll be talking today about facing your fears, treating anxiety in children and teens with autism spectrum disorder. Before we get started, I just wanted to remind you that you can submit questions at any time today by typing them into the question pane of the control panel. That's on the right side of the screen. We'll answer questions at the end of the presentation today. So to get started, I wanted to talk a little bit about some of the features that we often see in autism spectrum disorder. So there are a range of features that we often see in children and teens with ASD, and they include things like seizures. 1 in 4 children with autism also develop a seizure disorder, allergies, gastrointestinal disorders, obsessive behaviors, difficulties with emotion regulation, hyperactivity, and then the last piece that I wanted to emphasize today is comorbid psychiatric diagnoses. So many kids with ASD also experience a comorbid psychiatric diagnosis, and often that's anxiety. So I wanted to take a little bit more of a look at that. So children and adults with ASD have a higher rate of psychiatric disorders than the general population. So within a sample of 255 children with ASD, 71%, so almost 3/4, had another diagnosable psychiatric diagnosis. And you can see the breakdown here. It's 30% with oppositional defiant disorder, 29% with social anxiety disorder, 28% with attention deficit hyperactivity disorder, 10% with generalized anxiety disorder, 13% with panic disorder, 11% with enuresis, and 8% with OCD. So if we kind of look at what we would consider anxiety disorders within that sample, it's actually over 50% of kids in this sample had a diagnosed anxiety disorder on top of autism spectrum disorder. So we see that a lot of kids with ASD, a lot of kids and teens with ASD are experiencing high rates of anxiety. And just to kind of talk a little bit more about what we mean when we talk about anxiety, anxiety disorders share features of excessive fear and anxiety and related behavioral disturbances. So the difference between fear and anxiety, fear is the emotional response to a real or perceived imminent threat, whereas anxiety is sort of the anticipation of a future threat. And anxiety disorders differ from developmentally appropriate fear by being excessive or persistent. So everyone experiences some degree of anxiety, and anxiety can be a good thing. It can be motivating to us. But what's different about an anxiety disorder versus just experiencing some day-to-day anxiety is the extent of the worry, whether it's excessive and whether it's persistent, whether it's something that really kind of sticks with you over time. So some symptoms that we often see with anxiety, this is a list of some symptoms we often see, so things like difficulty separating from parents, excessive fearful responses to certain triggers, whether it's dogs or being in a bridge, on a tunnel, those types or crowds, those types of very specific anxious responses in terms of a specific threat, persistent and chronic worry, avoidance, somatic complaints, so things like unexplained headaches, tummy aches, just sort of aches and pains in the body, the presence of distressing thoughts, difficulties concentrating, feeling restless, feeling fatigued, feeling irritable, having disturbances with your sleep. So that could be difficulties falling asleep, it could be difficulties staying asleep, it could be getting up really early in the morning. So the sleep disturbance can take a number of different forms. And then overreactivity, physiological overreactivity. So having your body sort of be overly responsive to perceived threats in the environment. So when we look a little bit more about the overlap between autism and anxiety disorders, we can look again at some studies, and there was actually a study done at the University of Amsterdam that reviewed 31 different studies that looked specifically at the presence of anxiety disorders in children under the age of 18 with autism spectrum disorder. And as part of this study, they actually concluded that about 40% of the kids and teens with ASD had at least one diagnosable comorbid anxiety disorder. And this slide kind of shows the rates that the comorbid anxiety disorders were diagnosed. So we saw the most in this particular study, specific phobias, at 30%. And specific phobias, again, are worries of a specific trigger or specific situation. So again, it could be like crowds, it could be dogs, it could be traveling in a car, being on a bridge, it could be insects, elevators. There are so many things that could trigger a specific phobia. And then also we saw high levels of obsessive compulsive disorder, social anxiety disorder, and then generalized anxiety disorder, some separation anxiety, and then panic. So the takeaway with this, I think, is that there is a very high rate of anxiety disorders diagnosed in children and teens with ASD. And another thing to kind of think about is that even if there isn't an official diagnosis of an anxiety disorder on top of the ASD, anxiety is an important component in the everyday lives of many children and teens with ASD. So even if we can't say, a child or teen meets the criteria for an anxiety disorder, many individuals with ASD experience significant amounts of anxiety in their day-to-day life and have difficulty controlling that anxiety when something triggers it. So anxiety can make it difficult for children, teens with ASD to kind of live their everyday lives and do things like make friends, going shopping, taking public transportation. And so when we see that anxiety is getting in the way of everyday life, that's where we want to kind of intervene and think about treatment. So that's what I'll talk about next. I'll talk a little bit more about the treatment for anxiety. And the most evidence-based treatment for anxiety is cognitive behavioral therapy. And cognitive behavioral therapy, or CBT, focuses on the way that people think. That's the C, the cognitive piece of CBT, the way they act. So that's the B, the behavioral piece, and their thoughts. So that's the T. So the concept behind the CBT is that our thoughts about a situation affect how we feel, both emotionally and physically, and how we behave in that situation. So CBT works to try to change that pattern. So now I want to talk a little bit more about what are the core components of CBT. And then after we talk a little bit about some of the core components of CBT, then we're going to get into some modifications of CBT specifically for kids and teens with ASD and anxiety. So one of the first components of CBT is to think about the physiology and emotion, psychoeducation, and awareness. So one of the first things that we really want to do is to kind of teach kids and teens to recognize their emotions and to also recognize what it feels like to be anxious. So when you're anxious, you always have some sort of physiological response. There are some sort of cues that your body gives you that you're feeling anxious. So for this girl here, she's noticing her ears are feeling hot. She has sweaty palms. Maybe she's pacing. Her hands are flapping. Her heart's beating faster. She feels like she has butterflies in her stomach. So one of the first things that we want to do as part of CBT treatment is to teach kids and teens about anxiety and what clues our body gives us that show us that we're feeling anxious. This is a really critical piece because to be able to use coping skills, you have to recognize that you're feeling anxious. And so some of those signs that our body might give us that we're feeling anxious, sometimes we're not interpreting those as anxiety. We might be thinking that they're something else. So it's very important that kids and teens are able to identify anxiety so that they can then start to be able to use coping skills. So we always start with this component. And so some activities that you can work on to think about emotion identification, there are a few ideas that I've listed here. So one idea is to identify the range of feelings that people have and start to try to develop a vocabulary for talking about emotions. Another activity that you could do is do something with matching, so matching faces with feelings, recognizing facial expressions. There are a lot of role play games that you can do to kind of work on emotion identification. You can work on talking about different situations, different scenarios, and try to identify an emotion that fits that particular scenario. And with all of this, one of the goals that we want to try to do is to get across a range of emotions. So we don't want to just kind of focus on happy, sad, mad, the sort of basics, but we really want to kind of work on identifying a range of different types of emotions and situations. And one of the other tools that can be really helpful on working on this is using fear thermometers. So what fear thermometers can do is to kind of help create a new vocabulary for fears and to think about anxiety in a different way, that your anxiety across a different situation might be more or it might be less. It's not the same across all situations or triggers. So the fear thermometer or a similar type of rating scale can be used to start to discuss a child's response to situations that trigger anxiety and start to kind of like think about, okay, well, how anxious did this particular situation make me? And also, I think another component that can be really helpful in this is to, for parents and caregivers to think about where they would rate their child on a fear thermometer, because sometimes we see some differences there where a child might not report very high levels of anxiety. Then, parents are seeing very high levels of anxiety in response to particular triggers. So getting that information from both children, teens, and parents to try to think about coping skills and what would be the most effective coping skill. So the next really sort of key component of CBT, once the physiological and emotion identification piece is in place, is to start to think about some like relaxation training skills. So the purpose of relaxation is to help children and adolescents cope with the feeling of anxiety once they understand the physiology of anxiety. So once kids understand that feeling of heart racing, butterflies in your stomach, shaky hands, sweaty palms, that those are all signs of anxiety, the next thing that we can do is sort of teach some relaxation skills to cope with those feelings in our body of being anxious. So there are many different types of relaxation training, and I find that it's often helpful to try all of the different types and determine what's most beneficial to your particular child. Because I think some kids respond really well to certain strategies, really enjoy them, and really don't respond so well to other strategies. So to kind of give them the broad range and then see what's most effective. I think another thing about relaxation skills is that within the scope of CBT, it can be one of the most easily applied skills. And just to point out as well that this is probably more helpful as like a general life skill rather than a crisis skill. I think a lot of times relaxation skills and relaxation training are probably not the go-to strategy in a more like crisis situation. So one of the key elements of relaxation training is deep breathing. And what's important about deep breathing is that oftentimes when people are anxious, they start to engage in some shallow breathing. And shallow breathing can actually result in some chronic subtle hyperventilation. Hyperventilation can keep the body on sort of this like high alert and can result in more physiological responses like dizziness, shortness of breath, tingling in the extremities, which can actually, just make you feel even more anxious. That's pretty scary if you're starting to feel some of those other signs in your body and you might not recognize those pieces as, components of anxiety. So some ideas for deep breathing, some ideas for practicing. One of the key deep breathing exercises I like to do is something called belly breath. where you can have a child or adolescent place his hands on his belly and then breathe in deeply for a few seconds. And the key with this is that while you're breathing in, your belly should expand, and as you breathe out, your belly should fall. For some kids, a helpful way of trying to teach this is to actually have them lie on their back and have like something soft, like a stuffed animal on their belly, and they can kind of watch the stuffed animal rise and fall as they practice their deep breaths. So this is a script that you can use. I won't go through all of the pieces of it today, but if you want to have something concrete to use as a script to work with your child on some deep breathing, this is a really nice script to use that I really like. And then some other strategies. There are so many different ways to think about deep breathing. Some other strategies are using something called pizza breath, flower candle breathing. If you look these up online, you can actually see lots of videos online, which are really helpful to go through and see. So these are some more scripts, and you can definitely see some examples if you go to YouTube and try to look these up to kind of get some like video models of what this can look like. So another component of relaxation is progressive muscle relaxation, and that is the idea of increasing, again, the awareness of what it feels like to be anxious in terms of like anxiety of muscle tension, and then to be able to relax those muscles on cue. So what you do with PMR is to kind of work on tensing and then releasing each muscle group. So some ways of working on this with children are robot and ragdoll is one strategy. So where a child pretends to kind of be really tense and walking like a robot, and then you sort of let it all hang out. You're a ragdoll. You kind of let your whole body release and release all of that tension. And another way of doing this is cooked and uncooked spaghetti, where you sort of pretend like you're uncooked spaghetti and you're really tight and you're really tense, and then you're like a cooked noodle, and you can just kind of let it all hang out. And again, I think you can find some really good examples of what this can look like with video models online. So this is another example of a progressive muscle relaxation practice. These are all different body cues that you can use. So squeezing a lemon, holding your fist really tight, holding it for 10 seconds and then letting it go. Hiding in your shell is sort of raising your shoulders, tucking in, holding that for 10 seconds, letting it go. This is a tool from Autism Speaks, and you can check out the Autism Speaks website to learn a little bit more about this tool. But I think this is another really nice way of teaching progressive muscle relaxation. So some other strategies for relaxation: guided imagery, imagining a calm, safe place, and then really kind of picturing all of the sensory elements of that. So the sight, the sound, the smell, the taste, and then visualization. So visualization is having the child or teen pick something that she likes to do, and then to kind of really think about each aspect of that activity. So I wanted to include some more relaxation training videos that I really like. I think video modeling is a really effective way of trying to teach some of these components. So the next piece we're going to talk about pretty quickly is cognitive restructuring. So that is the idea of working to try to change thought patterns and model appropriate thinking. So identifying what worried thoughts are and what you can think about instead as a coping thought. So a really helpful way of doing that is to use thought bubbles. Thought bubbles are a great way to provide kids with a way to understand this process. Having pre-drawn pictures is helpful to kind of get them to understand how children might think, feel, and behave in different situations. You might want to start with something that's kind of neutral and then build up to something that's anxiety-provoking, and then have children practice using their own thought bubbles. So to develop a coping thought, first, you really want to identify what the negative self-talk was. So I was thinking I was going to fail my test and it was just going to be a total disaster. So the next part is kind of identifying that worry thought and then reframing that, trying to come up with a replacement thought. So instead, I thought, you know what, I did the best I could with my studying, and I'm, you know, as prepared as I can be. So really trying to kind of like reframe some of those worry thoughts. And then the last component that's really the key of CBT is thinking about exposure therapy. So that's slowly being exposed to the anxiety-provoking trigger. This is really kind of the most critical step in CBT, and it's also the toughest to implement. And so the idea behind it is that anxiety is maintained by avoiding a feared situation. So the principle of exposure is that by putting yourself in contact with a situation that causes anxiety, you're going to sort of slowly habituate to that trigger. So there are a couple of different types of exposures. There are imaginal exposures, so that's sort of more vividly imagining the feared situation. And then in vivo exposures, it's actually real-world exposure to the feared stimuli. So the way to kind of to get started with this is to create exposure hierarchy. So that's really to kind of break down the anxiety-provoking situation into smaller steps, and then work on facing your fears in each one of those steps. This is an example exposure hierarchy of a fear of dogs. And then so you're starting with, you know, what's the most anxiety-provoking is at the top, and the least anxiety-provoking is at the bottom, and you sort of work your way up from the bottom to the top. Okay, so now we're going to finish up by talking a little bit about some ways of modifying CBT for children and adolescents with autism. So CBT is the most evidence-based treatment for anxiety, but there are some challenges of using CBT with individuals with ASD. And one of the main challenges is that CBT is very verbally based, and it's often pretty abstract. So there are some modifications that are needed for traditional CBT to help individuals with ASD and to kind of have more repetition and use more visual and concrete elements to make CBT more accessible. So these are some modifications based on research that can be most helpful in CBT for individuals with ASD and anxiety. One is breaking anxiety management skills down into smaller steps. Using more concrete visuals and having more written assignments rather than all verbal, using special interests as a motivation and as a tool in therapy, having even more parent involvement in sessions and as coaches of new skills, having a lot more opportunities for repetition and practice, using video modeling, and we've talked about that already as, you know, thinking about how you can use video modeling to teach relaxation skills, and then token economy systems. So really thinking about how to use like principles of positive reinforcement in CBT through token economy systems. So there is a treatment, an evidence-based treatment for kids with ASD and anxiety called Facing Your Fears that I wanted to talk a little bit about because it really takes some of these modifications and implements these modifications in a group therapy setting. So what the program looks like is a treatment for kids and teens ages 8 to 14. It meets for 14 weeks, and it's an hour-and-a-half per session. The group is sort of varied. There are components where the kids work alone, the parents are alone, and then there are dyads, child-parent dyads, and then whole group work. So the first 7 weeks, we really focus on, you know, defining anxiety, identifying anxiety-provoking situations, and starting to develop a set of tools. So relaxation tools, helpful thoughts, some strategies for emotion regulation, and starting to think about exposure tasks. The second 7 weeks, we work on more exposures using the tools across settings and a video activity to kind of reinforce the core concept. And then we have a booster session 4 to 6 weeks after the treatment. So in terms of like the CBT components that I spoke about before and how it looks in facing your fears, in terms of relaxation training, we provide deep breathing and a script for progressive muscle relaxation, and we teach a lot of those skills through video modeling. There's a lot of repetition with the instruction. Every week we have a different child lead a relaxation exercise at the beginning and end of the group. And then relaxation, we kind of broaden out the concept, not just to be sort of deep breathing or progressive muscle relaxation. We also think about calming activities. And then in terms of exposure practice within facing your fears, parents and kids work together to identify targets for hierarchies and to create the hierarchies together. We do a lot of video modeling through watching previous Facing Your Fears movies of other kids providing examples of themselves facing fears. And parents do a lot of homework, creating exposure experiences at home. So that kind of brings us to our final piece, is the parent-caregiver involvement with facing your fears. So one of the things that we talked about was, modifications of CBT for kids with ASD. The parent-caregiver involvement is even more crucial, and parents are involved in every session of Facing Your Fears. So parents are a key part of the group and attend every group, and there is a significant emphasis on parent-child dyadic work. And there's also a separate parent curriculum to discuss issues like parental anxiety, parental styles, and barriers that may come up during the treatment in terms of implementing the exposure practice at home. So some strategies that families can use to help children and teens face fears: encourage your kids to be brave, and any attempts to be brave, really emphasize and encourage those attempts. Express confidence in your child's ability to handle her worries. Think about times when you faced a fear, when you've been in an anxiety-provoking situation and you were successful in managing that situation, and talk to your kids about it. And then the last sort of piece of advice is to really sort of help your child to make the connection between anxious thoughts, physical changes, and the behaviors that your child is demonstrating, and connecting that to anxiety to kind of help them to understand that some of those pieces are about anxiety. So the last piece is, again, talking about behavior management and using token reward systems in the group. So thank you so much for listening in today. We're going to take some time for questions. And if you have any questions about CBT or the Facing Your Fears program, please feel free to contact me, or you can contact our care management team, the social learning program. And I would be happy to talk a little bit more about CBT for ASD, or specifically about the Facing Your Fears program. Okay. So one of the questions that comes up a lot and came in today is a question about using some of these CBT strategies for kids on the autism spectrum who have more limited language skills. I wanted to talk a little bit about this, and there's more and more research to show that a lot of the principles of CBT can be very effective for kids with ASD who maybe have more limited language, but what it looks like might be a little bit different. So it might be that there's actually more emphasis on the exposure piece, and really of a significant focus on exposures, and less of a focus on the cognitive piece. So less of a focus on the piece of identifying worried thoughts, trying to kind of come up with replacement thoughts. So there are a lot of applications of these strategies for kids who have more limited language skills, and there's more and more research being done to kind of like think about how we can modify CBT to make it more effective and very effective for kids and teens with ASD who do have more limited language skills. So I think we have another question. Okay. So the question is about recommendations for books or online resources for kids under 8. Yeah, I think that I can actually send a slide out with some recommendations of books. One of the books that there are a couple of books that we use in Facing Your Fears. One of the books is Alexander and the No Good, Terrible, Horrible Day. I think I got the title wrong, but the idea behind using that book is to sort of normalize the idea that everyone has a bad day, and it's sort of like how you process that day and what can you do about it. So that's a book that I really like. In terms of online resources, there are a couple that I really like. One is going to YouTube. The link that I suggested for the video modeling is something called Go Zen. G-O, separate word, Z-E-N, Go Zen. I think they have some really good resources on YouTube of videos to teach relaxation training. So those are videos that I actually often use in session to teach like deep breathing. There's a video on something called 4-7-8 breathing. Another video that I really like to use of the Go Zen on YouTube is they have like a really nice visualization video. So that's another online resource that I really find very helpful. I can put together a list of other specific books and strategies and can make that information available so that you have some more ideas. But those are two that kind of pop out right away. I think we have another question. Is there a specific test for anxiety for kids with ASD? Yeah, so that's a really good question. So what we usually do is we will do an updated assessment to look at different anxiety disorders and to look at whether kids meet specific criteria for a certain anxiety disorder. So there isn't really a specific test, but we would want to do a clinical interview to get more information across a range of anxiety disorders. So we would want to ask questions that are specifically about separation anxiety, questions that are about social anxiety, questions that are about more like generalized anxiety. And with generalized anxiety, often what we look at are things like performance anxiety. That's often how it presents for younger kids. And then more specific phobias, we would want to ask a lot of questions about whether there's significant anxiety in response to particular triggers. So I think what we often do is more of like a general clinical interview, asking specific questions across all of those different areas of anxiety, and then we'll also have you and the child fill out some measures that look specifically at anxiety. So ones that we often use in terms of measures, we use a screener called the MASK. It's the Multi-Dimensional Anxiety Scale for Children, or the SCARED is another measure that we often use. So we use like a number of different tools to make the diagnosis. So it's a clinical interview, it is a combination of using these different measures and gathering all of that information to see if there is an anxiety disorder in addition to ASD. So that was the last question. Thank you so much for participating. On behalf of the Child Study Center, I want to thank you for joining me today. Once you leave the webinar, you will receive a survey, and we would appreciate it if you could complete it. You'll also receive a follow-up email within a day or two with a link to a recording of today's presentation. We hope that you can join us for our next webinar. There's a monster in my closet, dealing with the worries and fears of early childhood, with Lauren Knickerbocker on Tuesday, January 24th at 1 p.m. Thanks again. Bye.